Hi everyone, my name is Jacqueline Posada. I am one of the inpatient hospitalists at GW, and I have made a few basic videos to help you navigate Cerner during your inpatient rotations. So this video is going to cover how to set up the settings for each type of the notes that you're going to be writing on either 6 South or consult or discharge summaries. So let's get started. So when you log into the patient, like when you select a patient off of CORS, this is what it's going to look like. We really want you guys to write notes through the Workflow M page, which I'm going to go over in another video. But Workflow M page is where you get to change the settings for your note, which you're going to have to do as you move between services. So you're going to click on the Workflow M page, and then this is sort of your toolbar here for all of your notes. So the Admit Consult tab is where you're going to write your admission initial and evaluation notes, so your admission notes, initial consult notes. Manage is the tab where you're going to write your follow-up notes, and then Discharge is where you're going to write your discharge summaries. So going back to the Admit Consult note, you're going to scroll down and find the initial evaluation note settings. So for your initial evaluation notes to admit through the ER, so basically for the patients who come to 6 South, under vitals and measurements, you want vitals. You can include measurements, that's the height and weight, but the most important thing is that you include vitals. You do not need to include the mental status exam here. You'll include it later because this is the mental status exam that's documented by the nurses, so that's not your mental status exam. Next up on the histories, you should include allergies, past medical history, past surgical history, social history, and psychosocial history. You can also include family history. So I'm going to create a note in another video, but the important thing here is that this information is brought in by the nurses. So I don't know if this test patient will have anything, but you can click here and see what's brought in. And so this is something that was entered by the nurses, and maybe even brought in if the patient was already admitted through, like had a previous admission, maybe the problem list will auto-populate. But the important thing is that this stuff is not going to be necessarily entered by you, but if you have it clicked, it's going to auto-populate into your notes. You'll at least have the basics of the required note. And so the reason why like social history is usually going to be like the substance use history that's included by the nursing staff and the ER. So it's not going to be as detailed as what you're going to do as a psychiatry resident, and it may or may not be accurate. So I'm telling you that so you make sure you check everything. So on medications, I think essential is inpatient medications. You can check home medications, but what you need to know is home medications, quote unquote, this is going to be the list of medications that was reconciled by the nurse. So if they have documented the medication history, that's what's going to pop up here. So the reason why it's important is because you need to trust the person who did the reconciliation. If it's you, then go ahead and trust it. But if it's not, then be aware that it could be incorrect. But the inpatient medications are going to be anything that you started here. And then we're just going to scroll down to move across. And then just include recent labs. Everything will pop up. And then I personally include diagnoses. Not everybody does, but the reason why is if you happen to write your note in a different way, not through the Workflow M page, again, we'll cover later, then the diagnoses that are entered won't populate. So I think it's important to have it here so that way the diagnoses that you think the patient has are somewhere included in the note. And so that's your initial evaluation note, so you save that. Okay, and you're good to go. So next up is going to be the Manage tab for your progress note settings. So click the progress note settings. And so you essentially want vital signs, always. And I'm showing you this for your notes, but you're going to have medical students who are coming in and out of different rotations, and you're going to need to help them reset their settings, because you'll have patients coming in from OBGYN and they're going to have, you know, the infant breastfeeding information. We do not need that in a psych note. So when you have new students, make sure that you're helping them update their settings. You can include allergies. It's not really necessary on a progress note. Inpatient medications are a must. That way you can see as the medications are changed from day to day, you're going to see it. No need to include home medications. That's already in your initial evaluation note. And then just include recent labs. And then again, I prefer that you include diagnoses. So then save as you did the last time. And now you've got your progress note settings for psychiatry all set up. Next up, discharge settings. So again, you're going to go down to the discharge note settings, which are right here. We'll scroll down. So vital signs are a must. You're going to get discharge day vitals, allergies, that's fine. Discharge medications. So the discharge medications are going to be the list of medications after you complete the discharge medication reconciliation. So let's say that you generate the discharge summary the day before discharge, or for whatever reason, or before you do the med rec. Then when you generate your note, you need to make sure that you refresh the medications in the note, because that way it will reflect the accurate discharge medications. Because this is literally from a psychiatric unit, I think the discharge medications are the most important part of the discharge summary, so make sure that they're included. Discharge labs. You don't have to click anything else. And press save. The diagnoses are automatically included, so you don't on the discharge summary, which we will go over. So kind of while we're on this topic of like what should go in the notes and the charts, I'm going to show you a couple different things. So diagnoses and problem here on this far left menu, this is where you're able to, this is one place, there's several where you're able to add and remove diagnoses. So the reason why this is important is that when a patient is admitted through the ER, they get a lot of different diagnoses that you may not agree with. So for example, anybody who comes in psychotic, the ER is going to say they have schizophrenia. We know as psychiatrists that's not accurate. And the reason why you want it to be accurate is because when the discharge summary and the patient's discharge instructions are generated, it is going to give them a list of all of the problems that were entered into their chart. So if they actually have you diagnose them with major depressive disorder, with psychotic features, but then you didn't remove schizophrenia, it's going to be very confusing. So I'm going to show you here where to add problems. So you're going to go, I think the easiest way to add problems is through the workflow M page, and in your assessment and plan, oops, sorry, wrong tab. I was like, where is it? So in your assessment and plan here, this is where you add diagnoses. So for example, let's say we're working on a patient who has I think it's too detailed right now to talk about the specifiers and the code, the F code, but you want to have all of your patients' accurate diagnoses, and this tab is okay. Just try to add the one that's closest as possible. So let's say it's a recurrent episodes with psychosis, add that. Let's say they have alcohol use. Unfortunately, the disorders, these diagnoses do not really reflect the DSM, so I just pick whatever I think is close. And then I'm just going to add schizophrenia because I'm going to show you how to remove diagnoses. And I'm adding suicidal ideation because this is one of the most common diagnoses that the ER admits with, and you have to take it off before they're discharged unless there's somebody who has chronic suicidal ideation. And just to show you that like it is useful to add the substance use disorders because it's something that you're going to be managing and therefore it adds to the complexity of the patient. So as you can see, I've added a bunch of psychiatric diagnoses here, and so these are going to populate into the discharge list when you generate your note. So now I'm going to show you how to remove diagnoses. So you're going to go to Diagnosis and Problems, and now I refreshed and all of the diagnoses came up here. So the way, and you can see who added them. So I added these, and then, you know, another physician added ulcerative colitis, and it'll sometimes say just ER physician for the admitting diagnosis. So what you do to remove a diagnosis is you click on the diagnosis, right click, remove the diagnosis. Right click, remove the diagnosis. So really, like, our goal as physicians should be to chart as accurately as possible. So I know that this can seem nitpicking, but when you generate the discharge summary, all of these diagnoses are going to be on the patient's discharge summary. So you want it to reflect your accurate clinical decision making. I know it looks bad when I can't find things in the medical record, but I want to show you how to reorder the diagnoses, which is something that you're going to be asked to do by the nurses when you're generating the discharge summary. So I'm just going to try to find that. I usually do it through the billing. That's why I'm a little bit confused about how you guys do it. Okay. So it's here in diagnosis and past medical history. So right here in this tab, diagnosis and past medical history. The reason this is important is that when you are discharging somebody from the psychiatric unit, you want them to have a primary psychiatric diagnosis. And as the attending, when I bill, I order these diagnoses. But not all of the attendings do. You'll work with attendings who aren't billing as frequently or aren't full-time hospitalists. So on the day of discharge, the nurse will be like, hey, the patient has ulcerative colitis as the primary diagnosis. Can you change it? So this is how you do it. So in Workflow M page, under the Manage tab, you're going to go to Diagnosis, Past Medical History, and every diagnosis has a number next to it. So I'm going to scroll on down. You need to refresh, so all those diagnoses we added are there. And I'm going to order them. So let's say this patient, the primary problem we managed was major depressive disorder. If you number it number 1, it's going to rise to the top of the list. There you go. And then the second thing, let's say you started naltrexone for the alcohol use disorder, then make it number 2. And you did motivational interviewing for nicotine use disorder. And then you also, let's say you continue the medications for ulcerative colitis, then you manage that. And then any diagnosis that doesn't have a number next to it is not going to auto-populate into the discharge summary. So that's the basics of note settings and then how to number your diagnoses or prioritize them so that they're showing up in the correct order on your discharge summary.